You're listening to the Wired for Impact podcast.
That's really the impetus for this entire conversation, because it is, I believe, at an epidemic level where we're seeing masculine testosterone fall off a cliff, essentially. Can you give us a little bit more exposure to that? Like, how bad is it actually?
So amazing that you've used the word epidemic, because it is really at that stage at this time. So when I was studying medical school, we learned about late onset hypogonadism, meaning that you develop low T in your older years, which is expected. You get to 55, 60, testosterone levels start dropping at the age of 30, about 1% a year. By the time you're 55, 60, 70, it's kind of expected that you have low T. So that's what we learned, late onset hypogonadism. So when I first started my practice in 2005, 2006, most of my patients needing testosterone were late 40s and 50s. Over the last 10, 15 years, we've seen a phenomenon where younger and younger men are coming with low T. And true low T, testosterone levels low, and symptoms of low testosterone. And symptoms like being tired, no energy, gaining weight, low motivation, anxiety, depression, low sex drive. So we're having now younger men experiencing what we used to think of an older man disease. And when I started my practice, I started seeing young guys like this. It was even hard for me to realize that, wow, what's going on? Those guys are not lying. And, we tend to want to blame the victim a lot. A lot of times when I would talk to my friends and colleagues about this, they would just say, those guys are just fat and lazy. I don't like using those words, but that's what people were saying. Mm-hmm. And I was telling them, no, most guys, by the time they come to me, they've done their research, they're on supplements, they're trying to lose weight, they're meditating, they're trying. But I told you that you cannot out-meditate or out-eat a bad hormone level. When your testosterone or your thyroid levels are low, it's like you don't have a good baseline for your physiology or for your psychology. So when you have a young man with low testosterone, it is a tragedy. So yes, always bad to have low T, whatever your age, because testosterone is what really makes us men. This is really what determines how you react to the outside world. This is good not only for muscles or sex drive, but really important for our mind, our desire to continue to lead, to serve, to conquer, to become better at what we do. So when you have low T, a lot of those things you don't have. So imagine having that at a younger age. And one study that came out of the University of Miami that was truly career-changing for me. It's actually interviewed this doctor, Dr. Ramasamy, University of Miami. He came up with a paper where they looked at adolescents and young adult men between the age of 15 and 39, and they saw that there was a 20% incidence of low T in that population. Think about this, 15 to 39 years old, 20%. And their symptoms of low T tended to start at a testosterone level of 400. Really quick, normal testosterone is 300 to 1200. Conventional medicine will tell you, unless you're below that 300, you don't have a problem. But that study showed that for younger men, at levels about the 400, that's when they started with symptoms. And their symptoms tended to be more, not sexual, mostly low energy and low motivation. And we're looking at a lot of those young men in their 20s and early 30s, and you're thinking about this. And you're like, yes, there is a correlation.
Mm-hmm. What is the cause of it?
So that is the big question. So when I started my practice again, I'm seeing patients, I'm like, I'm excited. I'm changing the world. I'm helping patients feel better. I prevent them to go to the hospital. I'm doing preventive medicine, optimization medicine. This is great. Then when I started seeing younger and younger patients, I was like, what is going on? And yes, some of them were overweight. Some of them didn't have good habits. But eventually, I saw a lot of guys with good habits that still had low T. So I had to, again, question myself. It's not that they're just eating bad. It's not that they're just lazy. What is going on? And this is when a lot of studies are showing that really our toxic world, the endocrine disrupting chemicals, all the toxins like plastics, pesticides, now forever chemicals, all of this around us are specifically toxic to testosterone because all of them, they're estrogenic based. So it's almost like we're bathing our young men in a sea of estrogen from the time they're in utero, because it happens even in the womb, until now. So there is a concept called the exposome. It is what you've been exposed to from the time you're in your womb until now. And the exposome now is the most important determinant of health. And what we're seeing is it's been such a precipitous drop of testosterone, including sperm count for men. Sperm count is easy to count. Sperm count has decreased 52% over the past 40 years.
That's crazy.
52%. And sperm count goes with testosterone. So testosterone levels are decreasing at the same rate. So this cannot be our genes. Our gene pool did not change that quickly to account for this over the past 40 years. It has to be the environment. It has to be what we're eating, what we're breathing, what we're putting on our skin. We're being bathed and exposed to it from everywhere. And studies are very strong now. EDCs have a direct effect on our testicular function, on our testosterone function, and on sperm function. So this is a problem that's only getting worse. I interviewed this amazing epidemiologist, Dr. Shana Swan. She wrote the book Countdown. And she's the one who conducted the study that sperm count has decreased 52% over the last 40 years. And it's amazing that we're not talking enough about this. To me, it's an epidemic. It is one of the most important things that we're facing, because as a society, where are we going to go with this? So in her book, she says that if sperm count continues to decrease like this, in the next 40 years, 90% of couples will need some kind of assisted reproduction. Not sustainable. And now, not only is low sperm count decreasing, it's not just, all right, I have low sperm count, I'm going to have IVF, I have a baby, and I'm good. A low sperm count is like the canary in the mine. It's associated with poor long-term health in men. So that's only just a sign of increased risk of heart disease, diabetes, stroke, sexual problem, decreased libido, decreased strength of erections, ED. We're seeing all this in our society. So it's not our genes. It's our environment.
Thank you for listening to this episode of Wired for Impact. If you're interested in creating and expanding your impact, be sure to visit us online at impactnow.com.